With some of my patients, when we've done everything we think we can do clinically, helping them with their gum disease, and they don't seem to be getting better, I always like to dive a little deeper, right? We think about this as a three-tiered approach. I can do what I can do inside of the clinic, right? We can use our laser and our ozone, all sorts of other different kind of modalities, certain supplements, right? Then the patient has to do their work at home, right? They have to have good hygiene. They have to clean up their diet. They have to be sleeping well. And then the third component is their patient's immune system. What do we need to do to support that immune system? Because that is where we're getting the autoimmune attack of gum disease. That is where we're getting the cavities happening. So again, when we've tried to do everything, we've tried to optimize those three things, and we really need to see what's happening at a deeper level in the immune system. Traditional blood work is often worthless. Your numbers may all look perfect, but you're obviously having signs of inflammation and infection. So one of the tests that I really love the most is called the oat test, or an organic acid test. Super simple. I even do this. I've been doing this on my kids since they were really little. Just have to pee in a cup. So relatively easy. But what the organic acid test shows is a lot of information. So we get yeast and fungal markers, right? Again, if you've been listening to me at all, you know that I really believe that toxins and infections are at the cause of almost every disease. So what is that toxin? What is the infection? So there can be bacteria, it can be oral bacteria, it can be other types of bacteria. It can be Lyme, all sorts of things. But the organic acid test, and the reason I like this versus a blood test is that moment in time. Whereas the urine test is showing what actually got metabolized. So maybe you're eating all of your vitamins that you should be, but are you actually absorbing them? With the urine test, you're actually seeing what your body is metabolizing. So it gives a little better idea of how your cell's machinery is working. So we see bacteria markers, we can see if there's Clostridia, and then we can see what's happening in the mitochondria. How are you absorbing your amino acids? How is your carbohydrate metabolism working? We can see how is your glutathione, right? How well are you able to detox, which is also very important. We can see whether or not you're absorbing your B vitamins, right? We can see your neurotransmitters. That has a big impact. The gut, how healthy the gut is, greatly impacts how well we make neurotransmitters. And again, a bunch of other nutritional markers, including vitamin C, CoQ10 is really important. If you're on a statin, you might be very low. So it's another way to understand how we need to supplement our body specifically. So we can take all that information and then dial in more easily to try to enhance the immune system function. So this test, again, super simple, non-invasive, probably going to run you anywhere between $300 and $400. A typical conventional medical professional may not be able to run this for you. I certainly can. We do this a lot for our patients. So if you're interested, let me know. I can get you some more information.